New South Wales-Victoria border will be closed from midnight tomorrow night as Victoria continues to battle a spike in coronavirus cases. Victorian Premier Daniel Andrews confirmed the border closure following talks with the New South Wales Premier Gladys Berejiklian and the Prime Minister Scott Morrison. Victoria has recorded another 127 cases of COVID-19 overnight, bringing the state's total active cases to 645. 16 of the latest cases are from the public housing towers currently under lockdown. A man in his 60s has died this morning and a man in his 90s died last night, bringing Victoria's death toll to 22 and the country's total to 106. 31 people in Victoria are currently in hospital. 5 of them are in intensive care. Victoria is likely to be the state economy hit hardest by the COVID-19 crisis as cases continue to climb and additional restrictions are enforced. The latest Outlook report from Deloitte suggests every state and territory economy will suffer, but the largest downturn is likely to be felt in Victoria, in part because of the state's dependence on migration and foreign students. And there's evidence that young people are experiencing more negative mental health impacts from the pandemic than any other group. Research by Swinburne University has found that over the past 3 months, depression rates among 18 to 24-year-olds are almost 4 times higher than usual. The number of new cases in Victoria continues to rise despite the state having some of the strictest antivirus measures in the country. The host of the Health Report and the Coronacast podcast, Norman Swan, assesses the prospects of these measures working to get on top of the daily infection numbers.
What you're seeing today, we've said this before, you and I, that what you're seeing today is the result of what happened 5 or 10 days ago. You're seeing that reflected there because the virus takes that time to show itself. And the actions that you take today will take 5 to 10 days to have an effect. And so it's slow motion. You can't just press a button and things happen. And you've got to get in early and you've got to get in hard. One of the worrying things that's happening here, it's tough on the residents of those towers, is what they're not doing is removing people who are positive into a safe area for quarantine. So if you're going to ring fence effectively in this environment, what they did in Singapore is you take positive people away. It's impossible to physically distance in a small, cramped apartment. People need to be taken away to a hotel or some other environment where they're much freer to move around, where they can be kept in reasonably comfortable circumstances until they're no longer infectious. Otherwise, this infection could spread within families in that tower block and you don't get it under control, so you get a multiplication. You know, the guidelines are you stay in your own room with your own bathroom. Well, you've got to have 2 bathrooms to do that. This is just not possible when you've got 3 kids in a 2-bedroom apartment with 1 bathroom. And so that's another element of control that's really important.
You mentioned Singapore there. They were seen to get on top of the outbreak quite early. Then they saw a big rise in cases again. Was high-density housing partly responsible for that?
It was migrant workers or foreign workers, non-Singaporean workers in dormitory areas. And so they were it is different from the Melbourne situation, although it was very crowded circumstances where they were in dormitories, maybe 20 men to a room. It was largely men. And although some dormitories had lower density than that, and they certainly moved the men out of there into quarantine areas. But ring fencing such as this that's happened in Wuhan does include removing people from their environment into a safer circumstance. Now, they're not doing that, which means you could get a multiplication of cases.
So when might we see cases coming down in Victoria? Now we've got the border closure, we've got the renewed lockdowns, which are happening, also the changes to hotel quarantine enforcement in Melbourne.
Well, you'll see fewer cases in hotel quarantine because they're not coming in. So that's one thing. Community spread. I think you're going to see more community spread throughout Melbourne because I think they've lost control from the ring fencing. The ring fencing has not been complete. People have been going to work. And I think you're going to see spread to other areas and a citywide problem. It's going to take them a while.
All right, Norman, once again, thank you. Norman Swan, host of the Coronacast podcast and the Health Report on RN and 7:30 tonight.
Yes, on this topic.
Excellent. Thanks, Norman.